am Kelsey Gleason, and I am going to talk to you guys today about land use change, children's health outcomes, and the Brazilian Cerrado, and how all of these intersect into a really challenging environmental health issue we're facing not only in the Cerrado, not only in Brazil, but actually across the world. The Brazilian Cerrado is located here-ish, and it's a biodiversity hotspot, much like the Amazon, which all of you have, of course, heard of. But the thing about the Cerrado is the biodiversity aspect of the Cerrado makes it particularly vulnerable to things like climate change and land use change. So when we're seeing that climate change and land use change is happening at the same time, we're creating this atmosphere that promotes changes in waterways, promotes changes in economies, and promotes changes in how the health of our systems and the health of our children are behaving. So we're seeing a lot of increase in things like child chronic malnutrition, which we measure through stunting, and childhood diarrhea. We're concerned about childhood diarrhea because it is the second leading cause of death worldwide. Over 500,000 kids die each year from diarrhea. And this is problematic because diarrheal disease is 100% preventable, right? And it's really cheap to prevent. So we know that it's curable, we know that it's preventable, and yet it's still being a leading cause of death for these kids. We also know that the natural environment is associated with diarrheal risk. This is becoming increasingly more prevalent in the literature and increasingly more common in our communities. And finally, we're seeing that, of course, climate change is exacerbating both of these risks through all the different changes that I mentioned before. And so when we see all these changes happening in the Cerrado, Jillian Galford and I came together and we thought, okay, how can we better understand how these environmental changes in the Brazilian Cerrado are coming together to impact children's health outcomes that are really impacting long-term sustainability, economic outcomes, and overall health of communities. So we set out to do this with a gun catalyst project where we were hoping to examine the land cover and land use changes and kids' health outcomes using publicly available data, which poor Ariane over here had the pleasure of translating, downloading, scouring the internet, calling all her friends, family, etc., and building a huge database for us to be able to pull these associations out from. But we also wanted to build these international collaborations. So Ariane and Jillian and colleagues already had these existing collaborations with people and universities in Brazil, and we really wanted to build off of those to create this research network to answer these complex problems. And then finally, we were hoping that all of it will culminate in a larger grant proposal where we didn't have to use publicly available data. So what we found so far is that there are hotspots of diarrheal disease in the Cerrado. And when we look at changes over time, we see that there's like a little bit of overlap. If you squint really hard, you can see that there's 15 municipalities that have an overlap across both years. Not a great finding. We also tried machine learning models, also not super great. But what we have found so far is that there's a lot of great collaborations coming out of this work. We have these existing collaborations that I mentioned before. I also am fresh off of a trip from Brazil to meet with colleagues at Fiocruz who are really interested in pursuing this work as well. And we're going after a Welcome Trust proposal that we'll be due in a couple of months, and we're really excited to build out this collaboration and expand this work. So thank you to the huge team that made this possible.